We're going to focus on, things that we're hearing, constantly we're hearing from your government actually, and from your party is that more needs to be done. And right now, with the concerns we have with COVID-19, the advice Canadians and Indigenous people are getting is wash your hands and self-quarantine. So many communities don't even have running water to be able to deal with this crisis, or there's overcrowding in homes that would stop, and help with self-quarantine and certainly stop the spreading. Can you talk about concrete steps that your government is taking right now to support Indigenous communities facing this crisis?
Thank you, MP Johns, for the question. A very, very important question, and important to highlight that there are distinctions. Obviously, Indigenous populations are much more vulnerable for the reasons that you highlighted: overpopulation, overcrowding, and housing. Health outcomes that are lower than Canadians, than non-Indigenous Canadians, and access to and to healthcare in a culturally sensitive fashion. In terms of the specific measures that I highlighted in my introduction, the $79 million for emergency preparedness. Also, with the Prime Minister's announcement, $100 million of which First Nations can access in tandem with the amounts that were supported for provincial and territorial governments. The specific issues that you raised are very, very important, and we have not only surge capacity that we're working at internally in providing and getting out to communities. The fact that we have access to it and they have access to it should something arise, and that
they're not getting that message. They heard about the announcement yesterday. So I'm just getting a message right now from the new Chalmers Tribal Council president, and all they got is the announcement. They haven't seen any of this, and they don't know what's going on. They have questions, and this information has got to get out there.
You're absolutely right, and we have actually reached out directly into health centers and to health providers. Sometimes that information doesn't necessarily get back to leadership, and we can work on actually getting that information there and then directly into the public.
Can't get to the people if it doesn't get to the leadership.
I would ask Valerie to step in on that, because there was a briefing to all parliamentarians given this morning and some very important details. So I'd ask her to elaborate a bit on it, because it's a very important question.
Sure, absolutely. And within BC, the First Nations Health Authority actually is managing the planning and the preparedness and the response efforts. They're the ones that have been communicating with BC First Nations communities directly, because they have that direct responsibility. We are, however, engaging them in every single one of our calls and all of our meetings with respect to the national preparedness efforts. I even myself wrote last night to the CEO of the First Nations Health Authority to talk again about the announcement and how we will ensure that
will you be willing to follow up with me tomorrow to make sure that this message has got to the nations in my writing? Because clearly it's not right now.
I can confirm with you absolutely what communications FNHA has sent out.
Certainly when it comes to speaking of the urgency, does this not highlight the sense of urgency to make these critical investments that we're talking about and accelerate your timelines? When it comes to Indigenous housing, making sure that you've got Indigenous housing in not just on reserve, but of course, off reserve, urban and rural and northern housing. This is critical right now. Is the government looking at accelerating it in light of the crisis?
Given the options that we have before us, what we're looking at in case that there is an outbreak and there is a necessity to self-isolate is the optionality of having isolation tents, the ability of having increased personnel to address specifically overcrowding. And it is unacceptable. I think all Canadians need to realize the level of overcrowding that exists in Indigenous communities. We have made historic investments, but given the timeline that you're describing, the most expedient thing is to increase our capacity and to have a sensitive and appropriate approach, in particular to hand washing, but also the capacity to self-isolate. We know that the communities are more vulnerable, and that's why we're dedicating additional resources to that.
I look forward to seeing that happen. With regards to healthcare in Indigenous communities, especially in rural and remote areas, difficulty around transportation is something that we're hearing, and concerns, especially with the ice roads closing really soon. We also know that 40% of clinics have critical property issues. What's the department planning for the worst case scenario in these communities?
And 1 minute.
Again, Gord, we have a staged approach, and we, as the Prime Minister has mentioned, money is not an issue. This is about getting surge capacity in place and a staged approach. if and when issues occur in community. Again, it has to be appropriate to the community. We have to have that proper level of engagement and community.
We're happy to hear that money's not an issue. When we talked about disaster relief and evacuations like we're seeing in Courtenay-Alberni, who will be evacuated, as we know, in the coming weeks because of spring flooding, what are the plans to make sure people are kept safe, and not only in the process of evacuation, but also for those people temporarily living in an urban centre they might not be familiar with?
30 seconds, Minister.
Just a clarification, are you talking about Courtenay-Alberni and with respect to coronavirus or respect with
it's
potential flood?
It's going to be a combo because you're going to have to move them with spring flooding anyways. And what's the plan there?
Again, we're engaging with every community, and Courtenay-Alberni is not the only community at risk. And should communities be at risk, we'll be prepared to intervene in a way that isn't simply with respect to flooding, but also with respect to medical needs if the tandem occurrence of an outbreak occurs at the same time, which would be obviously
it's going to happen,
unfortunate.
likely. Yeah.
Thank you very much. And we go back now to